Hey, what's up everybody? Welcome to Medicare Millennials. AEP is coming up fast. So today's video, I'm going to explain exactly why cross-selling is more important than ever for Medicare agents and health agents in general. I'm going to lay out exactly why, theoretically, how you should go about doing it, and what some of my favorite products are. Before I jump into that, just three quick housekeeping items. If you're already established with your FMO, but you're not sure who you want to cross-sell, you can do one of those product lines. I'd be happy to send you a contract, give you a good commission, and kind of help train you just how to cross-sell that product, okay? So feel free to go to my website and reach out if you're interested just in adding a contract for like hospital indemnity, cancer, life insurance, etc. Secondly, I do offer a paid phone consultation. So this again is for agents that you're happy with your FMO, or you think you're going to like the FMO you've selected, but you just want some guidance on what's working for me, what's not working for me, what I recommend, what I think about your FMO, marketing. You go down the list. That's what the paid consultation call, again, on my website. And then finally, I do add timestamps in the description so you can kind of bounce forward to what's most relevant for you. I know I like that when I watch videos, so I'm trying to do that for mine. All right. And then finally, if you need a recommendation for what FMO to go with, you can also use the contact form on my Medicare Millennials website. So let's jump into it. This has become an even bigger need in my business, is to cross-sell. And here's kind of the fundamental reason why. Really, as Medicare agents, we're competing against a couple of things. Number one, we're competing against call centers, which are, they're going to do a lot of high volume. They want to switch people. And we want to retain the clients that we've invested so heavily in. So we want to differentiate ourselves from the call center. So I'm going to get into that. Secondly, we're competing against kind of the mass recruiting FMOs. So these are FMOs that dump a lot of their override money into different lead types for their agents. And they go, again, for the kind of high volume approach and less on the service side, a little bit less on the cross-selling. So we want to stand apart from those agents as well and really be that independent, trustworthy broker for our clients. And I think cross-selling is a big part of that. So there's two different high-level approaches, in my opinion, that you can take to the health insurance space, okay, specifically for Medicare. Number one is the higher volume approach. Okay, so this is a lower intent lead. It's a lower value lead. So when you're going for high volume, you're going to do things like telemarketing, massive Facebook campaigns, different like online forms that are a little bit gimmicky. They're going to be geared more towards extra benefits or words like free to generate lots of clicks and leads to give you higher volume, which there's something to be said about that strategy. However, you're not going to get as high value and high intent of clients from that method. So when you go with the high volume type of method, you're basically competing against the call centers. You're going to have lower retention, fewer referrals, and less overall compensation per client because they're not going to stick around as long. They're not going to refer you as much. And it's going to be harder to cross-sell when you're doing a high volume lead system. Now, that is not to say that there's not some positives to going about it that way, but today's video is about why we should be cross-selling. So the other way we can go about this business as an independent agent is kind of more the local advisor, one-on-one, I'm here for you approach. So that's going to be a little bit lower volume. You're never going to be able to duplicate this independent broker, trustworthy advisor process on as big of a scale as a call center or a massive low intent lead flow scale. It's just different. So you're going to have a little bit lower volume, but you're going to have higher value per client and a higher intent. So when you reach out to that client or they reach out to you, they're ready to do business. They're looking for the service that you provide. They feel like they're talking to somebody trustworthy and an advisor. So you can stand apart from the mass lead organizations. You're going to have higher retention, more referrals, and much more opportunity to cross-sell, okay? So that's kind of the big picture. Now let's talk about like why we need to gear up to do that during AEP specifically. Not only do we want to stand apart and build a long-lasting, like a clients that stay on the books for a long time, so we've got a large, successful, long-lasting book of business, but we also need help with short-term cash flow. If you're going for a lower volume, higher value lead or marketing strategy, then typically you're going to be paying more per client acquisition. Therefore, you've got to have some short-term cash flow. So one way I've talked about a lot is if you focus on T65s, your upfront commission is going to be significantly higher. However, if you're not focused on T65s or you still don't have the cash flow you need, that's where cross-selling comes in, especially during AEP. So as we move into this AEP season, a lot of our upfront commissions, we won't get it all until January or February. So how do we make it through? How do we afford buying leads? How do we pay our bills? How do we just keep operating during AEP as we wait on that big check to come through? So here are the main products that I like to focus on selling. This is kind of in order, but there's some flexibility here. In a caveat, I do not recommend that you try to sell all of these products unless you already know all of these products, which most of you watching this video probably don't. So the number one thing that fits just so well with Medicare Advantage plans are hospital indemnity plans. And my favorite company to sell for this is Heartland. They have a little bit higher premiums, but I just love the way that they service me as an agent and provide support and training there. And I like the product. I love their back office. I love their enrollment process. There's other big ones too, like GTL, Aetna, and so on. I like Heartland personally. The hospital indemnity plan really helps fill some of the gaps for those co-pays in a Medicare Advantage plan. So it can pay for the inpatient hospital stay copay, outpatient surgery, emergency room, ambulance ride, among other things. But those are kind of the big four things that it covers. And a lot of times they even have an option for a lump sum cancer. So you're kind of fitting this perfectly in like a glove to a product you're already selling. Your premium to the client is going to be somewhere between $30 and $60. So it's very affordable not for all clients, but for many of your clients. I think we get so used to free when we sell Medicare Advantage that we cut ourselves short. If you take the time and are honest about how that Medicare Advantage plan is going to operate, you'd be shocked to find that people are willing to pay for this plan so that they don't have to come up out of pocket for the bigger copay expenses with their plan. They're not going to run away from it. Free might help get you in the door, just that whole idea of free. But to really be an advisor, you'd be shocked how many people want to understand what they're going to be out of pocket and they're willing to take the steps and make the payment to make sure that happens. What I love about hospital indemnity plans, they're really fast issue. You're going to get paid anywhere from 40 to 70% of the annual premiums, depending which product you sell. So that's like you can, on average, your commission is going to be from $200 to $400 per sale. So that immediately, if you're going to be selling 50 plans during AEP, that $10,000 to $15,000 is going to be cash flow immediately. The other product that I began this business with is final expense insurance, okay? This is scary to a lot of agents, but it's actually the simplest product on the market. It is a simplified issue, which just means a few simple health questions, yes or no, and maybe a prescription drug check automatically happens when you apply for a final expense life insurance policy. If they're approved, they pay a flat amount, let's say $50 for a $15,000 policy. If they pass away, their beneficiary receives $15,000. The premium doesn't ever change. The policy doesn't ever expire. And this is built for seniors who didn't plan ahead. They don't have a lot of savings and they're never going to save if they haven't done it by this point. So it's kind of a stopgap to give them that peace of mind. They don't leave that behind. And guess what? You're going to get a commission first year annual premiums. If it's $50 a month, annual premium $600 a year. Your commission is going to be anywhere from 80 to 120% of those annual premiums. So your average commission is bigger than hospital indemnity. It's between $500 and $1,000, just depending on the situation. My favorite company to sell there has probably been over the years consistently Royal Neighbors and Mutual of Omaha. So if I can, guide you to a contract for either of those products or many others. Those are just my two favorites. Another often overlooked cross-sell is cancer policies. Now, these can be built in with HIP, but they can also be sold separately. And they can range from $15 a month on up to $50, $60, $70 a month. They fit amazingly with MAPD, but even better with Medicare supplements. And there's a simple sales pitch that you can learn when you get contracted with that product that explains why Medicare doesn't always cover the full cost of cancer and why they need this product. Dental and vision is a great add-on. We're seeing potential cuts in benefits on MAPD, so you can potentially sell a standalone dental and vision plan to your MAPD clients and certainly your Medicare supplement clients. I like Emeritus. They're a PPO, much easier to work with than a lot of the HMO or reimbursement plans out there. And then finally, if you want to swing for the fences, you can offer annuities. Most of the products that I've ever worked with are very simple. They are fixed rate or indexed annuity products. So in other words, they don't have any risk of losing money when the stock market goes down. They're not directly participating in the stock market. So it gives them that peace of mind. They still have either a fixed rate or an indexed rate to grow every year, maybe more modestly, but they don't have to worry about watching their portfolio tank. It can provide a lot of riders like long-term care benefits, streams of income for the future or income for your family in the future, and you get really big upfront commissions on this product. The commissions can range from 3% to 6-ish%. So if you were to sell a $100,000 annuity at a 6% commission, that's $6,000. I don't know about you, but that would go a long way for my marketing costs and helping me operate my business as I grow my renewals in the Medicare space. So this video wasn't intended to do a deep dive into each product that you could sell. However, I just gave you guys a really that pretty much covers the main cross-sell products that are easy to get into, not all at once, but if you were to pick one or two that make the most sense for you. I'd be happy to do a consultation to kind of guide you or give a deep dive into the type of cross-selling product that you're most interested in, or even to connect you with a contract. Now, again, if you do a contract with one of these products with me, you don't necessarily need to move your other contracts. You may be happy where you're at there, but you will get the coaching and the one-on-one help from me if you contract that product with me. The final thing that I'll say, guys, is as this AEP is going to be hectic, benefits are changing more than they have since I've been in this business, at least from the best of our understanding, and we've got to be prepared. You still have time right now to pick one product line to cross-sell for every single client. You need a plan ahead of time. How are you going to position it? What's your commission going to be? And integrate it into the plans you already have to grow your Medicare and ACA books of business. I hope this was helpful to you guys, and maybe I will do a deep dive into some different products in the future. You guys have a great day. Good luck on this upcoming AEP.